Hello, everybody, and welcome back to Beneath the Current. This is episode 8 of the Student Union podcast. And I have a wonderful guest here today. Dr. Prahar is an ADHD specialist. And let's just jump right into it. Would you like to officially introduce yourself and tell me a little bit about yourself?
Great. Thank you for having me on, Shannon. Really appreciate the opportunity to talk about adults with ADHD. I started out as a family physician, and my practice over the last 30 years has always been with people who have visible and invisible disabilities. So if you'd wandered into my waiting room, before the COVID pandemic, you'd see people in wheelchairs, people with walkers, or maybe people that look like you and me, but they had invisible disabilities like brain injuries or depression or other things. And then 7 years, so I've been doing that for 30 years, but over the last 7 years, it came upon that, and was my very first patient about 7 years ago, that came in and said, Dr. Parhar, I think I might have ADHD. And this is where I got a bit stumped because I had always thought ADHD was something that little kids got, specifically little boys got. I didn't know that adults could have ADHD. So in my entire medical training, I had 30 minutes on ADHD, and it was clearly something that kids got. So it was in pediatrics, it wasn't in adults. So I didn't even know adults could have it. And then so I did what most physicians do when they aren't the expert on something. I referred this patient on to a psychiatrist. And then the problems really began. I realized then that according to my staff, not only was there a long wait time, but the majority of people the staff were trying to refer him to actually declined the referral. And they said, no, we don't see adults with ADHD. And that's when started our journey on becoming more expert, training ourselves, going to the who's who across the country. And so we set up adult ADHD centers, and so that people can have their ADHD assessed in every Canadian province and every Canadian territory. And and our whole idea is that we are trying to remove barriers for people who think they might have ADHD to get assessed. Normally, when you have an assessment, can be quite costly in the thousands of dollars. So we've been able to keep the price very nominal, and so that people can get assessed. And so that's where we've been coming forward from. I'm a clinical professor at the UBC Faculty of Medicine, so we do a lot of teaching, we do a lot of research. So our center does the clinical assessments, but we do a lot of educational sessions for the public and for healthcare professionals. And then we do research where we're looking at different modalities of treatment and diagnosing ADHD. In fact, we're launching a multi-center international trial later this afternoon. So that's our centers, and we're really wanting to help adults who are struggling with ADHD.
That's amazing. So that's a heck of an introduction. Lots going on, obviously. So I guess let's start with the basic question for people. I guess right now, especially adults who are trying to figure that out. Can you explain what ADHD is exactly?
Great question, Shannon. So when you think about ADHD, I mean, it's simplest is to start with the letters, right? ADHD. So it stands for Attention Deficit Hyperactivity Disorder. And what we understand is that there's a problem with attention, there's a problem with focus, there's a problem staying, you know, um, attentive to the task that you're doing. That's the attention part. It could also mean that you're not paying attention to conversations, that your mind wanders, or mind wanders when you're doing tasks. So that's the attention portion. I think we all get that. The hyperactivity is a little bit different in that it needs a bit of unpacking. So when we think about hyperactivity, often we think about children that are bouncing off the walls, right? They can't sit
Right.
still, they're fidgeting. That's what we think of because we often think associate ADHD with physical hyperactivity, and that can happen with adults. So Shannon, if you and I were sitting in the same room, or you're seeing me as you are right now, I might be fidgeting with my hair, my glasses, or I might be clicking my pen, right? Like I may not be able to sit still. So certainly adults can have physical hyperactivity where they can't stay calm. But the other aspect of hyperactivity in adults that is really problematic is that adults with ADHD, the hyperactivity can also manifest itself with such as angry outbursts, right? We call it emotional dysregulation. So having angry outbursts, crying outbursts, right? When I'm giving a presentation on this, I often show a picture of the Incredible Hulk, right? So he's this meek, meagered professor type, and then
Right.
something's off, and he turns into the Incredible Hulk, right? And that's what some people with ADHD experience. So there's that emotional dysregulation. The other part of ADHD that's the hyperactivity manifesting itself in other ways is that adults often also get impulsive behaviors, right? And those impulsive behaviors may be binge shopping, online gambling, online porn or sexual activity that you otherwise wouldn't engage in and is risky for you. Binge eating, binge drugs, binge drinking, right? Trouble with the law, doing something where you know better and you know you shouldn't, but you do it because it's an impulse and you can't control it, right? So it can manifest itself in all sorts of other ways. So to answer your question, it's an attention deficit problem, but there's also physical hyperactivity with some impulsiveness. There's also this emotional dysregulation. And what we understand it to be is a neurodevelopmental condition. So the research right now isn't saying that you wake up with it at the age of 23 or 33 or 41, that it's something that you have from childhood and it just continues with you into adulthood.
Oh, interesting. Yeah, that was actually going to be one of my follow-up questions was, is it something that you're born with? Is it something that you can develop? Because I think a lot of people are curious about that, right? It's like you can go for 10, 20 years and not show anything, and then suddenly, you figure out maybe you have ADHD. So I guess you answered that question is that when you say it
Yeah,
develops in childhood, are you born with it, or does it develop early, or can it be either or? Like, where does it come from?
yeah, brilliant, brilliant. So this is what we're all working on, is trying to understand it. So what we understand right now is that there's definitely a genetic component,
Okay.
which means that if one of your parents have it, you're more likely to have it. If you're a parent and you have it, one of your children are likely to have it.
Okay.
If you have it in your family, one of your siblings is more likely to have it. If a sibling has it, you're more likely to have it. So we definitely know there's a genetic component, and researchers have actually identified the genes that are associated with ADHD. So we know that there's a genetic component, and you can almost track it in the families. When we started our center, Shannon, we 7 years ago, we were really polite about it. We'd say, "Do you think there might be someone in your family who might have ADHD?" Now we just say, "Which parent has it?
Yeah.
Which kid has it?"
Yeah.
Which because they'll say, "Yeah, dad has it, or mom has it, or my brother has it," and
Right.
so there's definitely a genetic component. But here's a part that's even more fascinating, is that yes, there's a genetic component, but what we're understanding is that there are things in the environment that amplify or bring it out more, right? So if somebody with ADHD has it from birth and it shows up in elementary school years, and we can talk about how it shows up in early life,
Yep.
but what amplifies or makes it worse can be childhood trauma, right? Can be sexual trauma, can be physical trauma, abuse. It can be things in the environment. So, not having a safety net, or being lower on the socioeconomic scale, not having food security, housing security, those toxins in the environment we're looking at now. If your mother, while she was pregnant with you, was ingesting chemicals or alcohol or other things that might be harmful, that puts you at higher risk for, again, amplifying ADHD. So I'm not saying those things in the environment, Shannon, cause ADHD, but what happens is if you have a genetic predisposition, meaning that you have a genetic likelihood of getting it, those other things in the environment can make it worse or more disabling. Yeah.
Wow. Yeah.
But we do understand it to be a neurodevelopmental condition. So there have to be significant symptoms. And the way that our diagnostic criteria work is there have to be significant symptoms before the age of 12. Now, I'm thinking about your university population in post-secondary. A lot of people that are listening to this will have had no problems earlier, and now they might be struggling at university or college or work, frankly, whatever they're doing after 18. And so then someone says, well, you couldn't have had it because you didn't have it as a kid. And that's one of the things that we need to also unpack and understand, is that it probably was there before the age of 12. It doesn't mean, okay, another way to say it is, if you are looking at, maybe you have ADHD and you're 19 or 20 or 26, it doesn't mean that you have to have been diagnosed before the age of 12. You have to have had the symptoms before the age of 12. So if you're 23 right now and you think you might have ADHD, the person doing the assessment will ask you those childhood questions, and they want to know, what were you like in kindergarten? What were you like in grade 3? What were you like in grade 5? And that is because there have to have been significant symptoms before the age of 12. And that can be a bit deceptive too. There's something we call masking, where people are often fake it, hide their symptoms, or their supports around them, Shannon, where those struggles aren't identified, right?
Right.
And I'm thinking about this one fellow I saw, and he was going to one of the universities in your province in Ontario, And he had done great in elementary school, great in high school. He always had, the equivalent of straight A's. And then in high school, honor roll, was on the basketball team captain, student leadership. So he did really, really well. Goes to university, first term, fails most of his midterms, right? December exams, he actually fails four of his five courses. By second term, he's actually already on academic probation, right? And and when you talk to him, classic ADHD symptoms now, and he met the criteria. Then you say, well, what happened? What happened in elementary school? What happened in high school? You were like a superstar.
Right.
And if you start unpacking it, it was actually interesting. He said, funny, Dr. Parhar, in grade 4, I remember getting a B, the equivalent of a B in math. My parents hired not one, but three math tutors, right?
Wow,
And
over a
so
B. Okay. Yeah.
for a B, right?
Yeah.
And he said, and when I was working on my English essays, my mom, who's a librarian, she would help me sort of edit them. I said, did she edit them? He said, okay, she more than edited my English essays. So I'm not suggesting that happens in every situation,
Right.
but that's what we call the scaffolding or the systems around people. And sometimes they can be that sort of overt, but sometimes they can be a bit more subtle where somebody's giving you guidance or supports. And so elementary and high school might go fine, but guess what happens at university? You pull that scaffolding out, and that's where students crash and burn because now you don't have that structure. Even things like, and this might sound silly, but even things like your parents or somebody around you waking you up to go to class, right?
Yeah.
Who's going to do that for your university? You could sleep for 3 days and they might not notice that you're gone, right? And
Right.
and so and so when those structures are pulled away is why we see a lot of university and college students at our centers. And part of it is and why there's a delay in their diagnosis is people keep telling them, oh, you couldn't have ADHD because you got into Cornwall. Like there's no way that, or you got a scholarship and or you've done great at school or you've done great at work. There's no way you could have ADHD, and that's a myth. There's a lot of people who are very successful that have ADHD, and Shannon, what happens is sometimes, then not sometimes, everybody gets just something in life that's hard for them, right? And when that thing that's hard for them happens, people with ADHD struggle because they don't have the attention and focus to work through that thing,
Right.
right?
And I guess, sorry, not to
No,
cut
no, no,
you
it's
off,
always
just
fine.
sort
Yeah.
of like following up, like, so when you're in grade school or high school and, school is hard generally, right? But if you have, let's say you live with your parents most of the time, it's like, they're there for you to provide the structure, and that's less load on your own brain, right? And then as soon as you get up in college or university, like all of a sudden you're left to your own devices and you don't have that guidance the same way. Like you said, you could disappear for 3 days and no one's gonna notice,
Absolutely,
and
absolutely.
then
And I'm
yeah,
I'm a prof at UBC, and I can tell you that I've got 300 students in my medical class, and one or two are missing. How am I going to know,
yeah,
right?
yeah, of course,
Right. And so, but going back to there's another element here too, and this is my theory. I don't have the research to support this, but I'm going to tell you what my theory is. I think people with ADHD are actually of a higher IQ, i.e., smarter than the rest of us mortals. I actually think that people with ADHD, and the research doesn't support that. Research says that people with ADHD have the same IQ as people without ADHD. So with IQ is about the same. I think they're wrong. I think that people with ADHD have a higher IQ. Now that's a double-edged sword, right? So what that means is when you were in when we were in grade 3 and I didn't know my multiplication tables, what happened? I rolled up my sleeves and I taught myself my multiplication tables.
right,
So two things happened. I learned the multiplication tables, but I also learned how to learn, right?
right,
I learned how to teach, how to grasp new material that was hard for me. What happens with people with ADHD is because they're smarter than the rest of us, they catch on to things quickly, is they flew through elementary school. Stuff, elementary school was easy for them. And they'll tell you, they're like, I never studied. I never did homework, or I did homework in class. When I
right,
say homework, I did homework in class and never took it home. Or I would walk into an exam in high school and not bother studying or read it on the bus on the way to school. And then I'd get like, maybe not an A plus, but I got an A minus or a B plus, and that was good enough. Right. And so it's a double-edged sword. So on one hand, it was great that they did so well in school, but the bad parts of that are that they didn't learn how to learn. And like I
right,
said, if once they get to that really tough, whatever it is, calculus or art history course or something, law, they get into something tough at university that actually requires concentration. Now they're struggling because they have problems with concentration and focus, but they never learned how to learn because they didn't need to. right? Things came easy to them.
Right.
So we see a lot of situations where university or college students say, Dr. Parhar, I don't know. I don't know what happened. I was a straight A student. Like, why am I struggling now? I've never failed an exam, right? And that was because their ADHD was always there, but it wasn't diagnosed.
Right. It's kind of interesting that you talk about your theory, and I love talking about this kind of stuff. So for myself, I'm a musician, and the parallel to this is I've done some reading on research and theories about musical savants and mental impairment, and there's a huge link, and I believe there is some data to back this up, where there's something like, only 1,000 people in the world are considered a musical savant, which, for those of you that don't know, it's basically a prodigy, right? Somebody who doesn't have to think about music. They're crazy talented, but it's something insane. Like, I don't quote me on the numbers, but something like 80 or 90% of musical savants have impairment. And a lot of the times it's on the spectrum, and they're incredibly high on the spectrum. And I think it's interesting because my theory behind that is, if your brain is not doing certain things, like your whole brain is there. Everybody's got 100% of the brain in their skull, right? But different neurons are just working differently. So I feel like if you have impairment somewhere, that energy is probably going somewhere else, right? So, and I if I had to guess, like, that's what I think you maybe feel with ADHD and a higher level of intelligence. It's all right. Well, you can't sit there and focus, or you have hyperactive tendencies, but like, those neurons aren't always going firing the same way, but that's still going somewhere. So maybe your IQ is a little higher because maybe math comes a little bit easier to you, or things like that come a little bit easier to you, right?
Yeah.
I think there's a parallel there to be said.
Totally, totally. And what you've said in a very, very eloquent way, Shannon, is this is what we're calling neurodivergence, right?
Right.
What we're saying is, as you said it very nicely about the neurons working differently. I've got a picture of a brain PET scan, and what PET scans show is activity going on. And if you look at it superficially, you'll see that the ADHD brain has less activity going on in it than the non-ADHD brain. So to say it again, so the ADHD brain PET scan shows less activity. So it means that the ADHD brain has less activity going on in it than the non-ADHD brain. But if you look at it very closely, there's actually areas in there that have higher activity going on in them
So like
than
concentrated in
non-ADHD.
different areas of the brain instead of spreading around.
And it's a dynamic thing. I can't say, okay, it's always going to be this one area that in this person's going to be, let's say hyperactive and less active in these areas.
Right.
It probably changes. So it goes back to and this concept in neurodivergent is that everybody's brain's a bit different. It's just, we've been able to sort of quantify and maybe label some of them, for example, ADHD, and you talked about autism spectrum disorder or learning disabilities or learning differently, is that people not probably, people have different, everybody's brain's different. And so this concept of, and when you said the musical savant, I think that's a brilliant example, right? Being able to focus on some things and maybe not on others, and then also the creativity that comes from that. We see a lot of artists who have ADHD, right? And the first question that comes that they ask after we make the diagnosis is, "But Dr. Parhar, this isn't going to affect my creativity, is it?" And I'm like, "What?" And he said, "Well, that's what makes me a great sculpturist. That's what makes me a great comedian. That's what makes us a great artist or musician, is I think like other people. I think differently than other people think.
Yeah.
And that's what brings me the creative, powers that I've got." And so I'm always careful. I know you've heard, and you've probably heard others call ADHD a superpower. I get nervous using that term because for a lot of people it's very disabling, and they would be offended if you said ADHD is a superpower, because a lot of people it's really, really disabling, and it's hurt their lives and their relationships. So I don't call it a superpower. But having said that, I think there's something to be said for some positives about an ADHD brain that other people don't have. And I think it's good to recognize that positive.
Yeah, I think it's important too. Like you said, it's an important thing to touch on, is that at the end of the day, it's a disorder. So you don't want to blanket everybody and say, "Oh, if you have ADHD, you have a superpower." I almost feel like that could be detrimental to somebody who it heavily affects, right? Because let's say you have ADHD and it's disabling for you, right? And you wouldn't want to hear, "Well, it's a superpower," and then maybe like that would probably make somebody pretty upset.
Yeah, yeah. And it's interesting, absolutely. And I was just thinking about your the artist and the creativity bit, because my response to them always is, you know what, I don't think it'll dampen your creativity. But here's the thing, the treatments that we're offering, you don't have to take them continuously. So if you feel like you need a little break and you do need that creative weekend or that creative week, you can take yourself off the meds for a bit. But here's the other challenging thing that, or this is how I challenge my artists, patients, is I say, so you got the incredibly great idea. Have you always been able to bring it to fruition? Right?
Right.
Because that's the part that gets lost sometimes with creative people is they get all these brilliant ideas, but are you able to write that novel? Are you able to put together that art piece, or put together that music piece? And managing your ADHD will help you focus so that with that great idea, you can do what you want with it, right?
Right. So
Otherwise, it's just a great idea that didn't go anywhere, and that might be okay. But if you want to do something with it, then you need the ADHD better managed.
yeah, so I guess that kind of clears up a myth, right? Is saying, look, if I seek treatment for my ADHD, it doesn't mean that it stifles your creativity or gets rid of that. It actually enables you to put things down on paper or put things down on the computer, right? So,
Yeah.
and I think that's a common, you could call it maybe a misconception, with, especially if you're talking about taking drugs to deal with any medical condition. There's a lot of people think, it turns me into a zombie, or my brain will slow down, or whatever. But I also think it's important to note that A, that's not always the case, and B, there's other methods of treatment, right? Um, that kind of leads into like another question that I have for you.
Sure, sure.
Um, if we're talking about maybe from a non-medical standpoint, do you have any strategies, or maybe some advice that maybe somebody who thinks they have ADHD, whether or not they've been officially diagnosed, let's say you think you do, what are some strategies that students can implement to maybe support and manage? Like you said, they got all these great ideas. What do you think would help them get the ideas on paper?
Excellent. So firstly, like any condition, it's good to clarify whether you have it or not. And I'll tell you, when people come to us, and this has happened, even before the pandemic and certainly since the pandemic, people come to us and they're in sort of two camps. One group comes to us and they think, I thought I had ADHD, and you know what, you guys confirmed it, and I don't want anything done. I'm not at my A game, but for what I need to do in my home life, my work life, my school life, my relationships, I'm doing okay, and I'd rather not do any treatment or interventions, whether they're medication or not. I'm okay. But I
Right.
just wanted to do this because I wanted an explanation for why my life has been this way, right? Because people over the years have told me that, I'm lazy, I'm dumb, I'm not motivated, I'm not going to do well in school. And I always felt like I was putting in 4 times the effort as everyone else, but not getting the results. You've explained why my life was different, and thank you, right? And just to aside on that note, people often ask us why I got into this work. Is not only does it upset me that people with ADHD have been told they're not motivated, or they're lazy, or they're not going to do well in school and work or in relationships. That bothers me, Shannon. But you know what bothers me even more is that those people have started to believe it, right?
Yeah.
They've started to believe it. And when you talk to them, oh, I'm just not good at math, or I was never good at school. No, you weren't. It's like telling a diabetic patient, oh, you don't have a condition or a disease, you just have high sugars. Well,
Right.
no, it's a
Yeah.
condition that it's a medical system's fault that we didn't diagnose you earlier, but you had a condition that should have been addressed. And that's what people tell me when we do diagnose them as university students or college students. They'll quite with quite a bit of bitterness. They say, Dr. Parhar, where were you when I was in grade one? Right? Where were you when I was in grade three? But anyway, so the first camp are people who want to know that they have it, but don't necessarily want something done. The other group, Shannon, are people who say, okay, I thought I had it, you guys confirmed it. Now I want something done because I'm not hitting my goals academically. I'm struggling at work. I'm struggling in my relationships. I've got substance issue. I may have binge eating. I need something done and help me move forward. And when we do that, medications is an option. And yes, they work for a lot of people,
Yeah.
but we really, really encourage the non-medication options. And this was your question. So there's ADHD coaching, and specifically focused on post-secondary students. So to your listeners, if you're thinking that you have ADHD, you can line up for ADHD coaching. A lot of it's funded. There's grants and student bursaries and stuff available for the coaching. And these coaches have specifically focused on post-secondary students in university colleges, technical schools that have ADHD. And they'll help you set up systems around you so you can stay on top of those term papers, so you can get those, midterm stuff done, so you can be successful at your exams and so forth. That's coaching. Then there's ADHD counseling. ADHD counseling is more about, so ADHD coaching is about productivity and being successful, setting goals, reaching goals. ADHD counseling is more about how ADHD has harmed you in the past and what you need to get through that. So if ADHD in the past, because you didn't do so well in school, has hurt your self-esteem or your self-confidence, you probably need some counseling. If ADHD has made you feel sad at where you are in life right now, you might be a bit depressed. You may need counseling. If it's strained relationships, that could be it. So ADHD counseling, and I always say this to my post-secondary students, try to get that through your post-secondary institution. I know the resources are limited, but as part of your student fees, you have access to student health, and part of student health is counseling. I know they may not have unlimited sessions, but start there first so you don't have to pay separately for that. And then the other part, especially for students, that's really important, and I would like to highlight this for your listeners, is that once you have a diagnosis, then we can help you get academic accommodations. And what that means is we recommend that people with, and it's each student's different, but if I can give you some general accommodations. So the students with ADHD get extra time for exams. And we use a formula of 1.5. And what that means is you take the time that everyone else gets and you multiply by 1.5. So if everybody gets 60 minutes, you get 90. If everybody gets 2 hours, you get 3 hours. So we multiply by 1.5. So it gives you extra time. And what that does for the student with ADHD is it reduces, they may need the time because they take longer to focus and read the questions and answer them. So they may just need the time. But for a lot of them, just knowing they have the extra time reduces the exam anxiety, right? So they do better and may not even use the extra time. So that there's the extra time, a separate room to write your exams, right? And so that a lot of times, that person sniffling in that front row or scratching on their paper is distracting.
Right.
And it's distracting for everyone, but more so people with ADHD. So a separate room to write your exams, extra time for projects and assignments, right? And then specific things like if you need the PowerPoint slides from the professor or the TA in advance, we can help you advocate for that. And if you need a tutor or you need other aids, then it's more of an individual thing. But those are some of the more common accommodations, and students do better with it. And just because I've said it, Shannon, I need to highlight something else.
Yeah, of course.
Having ADHD is a confidential medical condition, right?
Yes.
So when you ask for accommodation, your profs, your TAs, the people on the academic side of your university life are not allowed to know your diagnosis. You want to tell them, that's your prerogative, but they're not allowed to know. So typically you take our accommodation recommendations, and every university calls it something else. There's access and diversity or student success.
Right.
You take it to the office, and that office then will help you set up the accommodations. That office might be allowed to know your diagnosis, but they're not allowed to tell your profs and TAs. Now, can the profs and TAs, speculate? They could, but
Yeah, of course.
but they're not allowed to know the diagnosis. So if you're not wanting to disclose because you don't want people to know that you got a particular condition, you shouldn't have to disclose that. Yeah.
I think that's really important to know, actually. And a couple of notes you kind of touched on. One is the like the counseling and stuff at the schools. I'm very happy to say that while we are a small college, we actually have a great support system for things like that. So that's a huge plus, and it is a great avenue for students to explore if they suspect anything at all or just need counseling. I also think it's interesting that you actually speak about why the extra time helps students, because I think a lot of people just don't know why. And you touched upon it yourself, right? That IQ levels are pretty much the same or pretty close, or you have a theory about ADHD students having a higher IQ. They don't need more time because they don't know the material. It's just knowing why or how the extra time helps them, I think is actually really important, right? Because also sort of puts other students at ease, like, well, why does he get an extra half an hour? Or why does he get an extra hour? It's like, well, you touched on that. So I think that's great, because even for myself, I didn't know what the extra time actually does. Or of course, when you're younger, you think, oh, well, he just doesn't know. Like, he just needs more time because he's not as smart. Like, that's just how kids think, right? So I think it's important to bring that up. So that's great. Thank you for that bit of background. I actually, and kind of pertaining to that, you said speaking to counseling, maybe trying to figure out if you have ADHD or not. For young adults, let's say anywhere from 18 to 25, it's a pretty average start for college university students. What would be something that you would want to look out for that maybe would be a sign that you have ADHD?
Yeah. So I think the things that would draw your attention to thinking about ADHD, if we look at the attention part first. So you're sitting in lectures and you just can't pay attention to the prof that's speaking or the TA that's speaking. Now, if you're not paying attention because it's really, really boring, that's a different issue. But if you're
Yeah.
actually
Yeah.
genuinely, okay, I won't go there, Shannon. But and some of us want, and I'm notoriously bad for having given 3 hour lectures, so I'm just as guilty. But my point is that, and I'm sure my students tune out after 40 minutes, despite my brilliant jokes. But my point is that if you're genuinely interested in the topic, but you just can't keep your attention on it, that's often one of the telltale signs. Or you're reading, right? You've got readings to do, and you read a paragraph of your mandatory readings, and you just didn't retain any of it. Like you've got to go back and read it again and read it again and read it again. Or you've got that assignment that's due on Friday, and Monday you procrastinate, Tuesday, and we all procrastinate. That's not necessarily ADHD,
Right.
but you leave it right till the last minute. I remember this young guy was a university student. I said, wouldn't it be great not to do things at the 11th hour? And he said, Dr. Parr, 11th hour, I would be happy if I didn't do it at 11:59.
Yeah.
And, and so, and if you think about what happens there, it's the do or die thing, right? It's
Right.
kind of like there's a deadline, I got to get it done. You get the adrenaline rush and you just do it and you pull the all-nighter. We've all been there, right? You pull the
Yeah.
all-nighter, you get the thing in. But why could we, and we always say, no, no, next time I'm going to start 5 days early. We always promise ourselves that. So,
Right.
procrastinating is often a big thing. Making careless mistakes, right? Now there shouldn't be any excuse. I won't even get into the chat GPT thing, but even in terms of editors and grammar and spelling checks is what I meant. So really, you shouldn't have errors. But if you're submitting papers and things with careless mistakes that you knew you should have caught, right?
Right.
Or if you're doing some sort of exam and it's like you shouldn't have made that mistake. So careless mistakes is another one. And then on the other side, so that's the attention and not being able to focus. A lot of unfinished tasks. You're right. You've got a bunch of projects and you haven't gotten past any of them. The joke I always tell is that you've got 7 IKEA projects and Allen wrenches everywhere, right? And they're only partly started. And before you finish any of those seven, you go and buy the eighth one,
Right.
right?
Yeah. I think that's a great analogy. Yeah.
Yeah, right. And you just don't, so all that unfinished stuff. So that's the attention focus side, and that'll affect your marks. That'll affect your attendance in classes. That'll affect your academic performance, obviously. And then on the hyperactive side, a lot of that stuff tends to be a bit more social, personal life. And so that might be those angry outbursts. You're losing friends because you're yelling and screaming all the time, or you're at functions and your limit's one or two beverages, but you have five or six, because of that, you can't control the impulse. Or you do the binge eating, right? A lot of people with ADHD also have binge eating disorder, and that's a condition unto itself that a lot of ADHD medicines can help treat. So the binge eating, the binge drugs, road rage, right? Again, doing the impulsive things that you're going to regret later. And it strains relationships, right? And I remember the student that was from Australia, and she came to see me during the pandemic, or we visited over video over the pandemic, and she said, "Dr. Parhar, I'm buying stuff online that I don't need with money I don't have." And so she had maxed out, 3 credit cards, but she just couldn't. And everybody jokes about how they shopped during COVID, but
Right.
but this was at another level, right? Like her cards are maxed out, and she would just keep, get another
Right.
card
Like
and keep
crippling
shopping.
debt status, like
Yeah, yeah,
detrimental
yeah.
could be to your
And
life. Yeah.
yeah, yeah, and online gambling, which reminds me of something that is another myth, right? So a lot of times people will say, "Oh, no, there's no way he or she has ADHD. They can play video games for 11 hours straight, right? They're able to focus when they really want to focus." So there's a concept called hyper focusing, and that
Yes.
concept of hyper focusing does not rule out ADHD. In fact, it's a symptom of ADHD. So what hyperfocusing means is that somebody will, and young people do this a lot, will focus on one thing. It could be a video game, it could be a project, could be a volunteer thing, could be a web page you're designing, eh, but focusing on that and hyper focusing on that and excluding the rest of the world, right? Not eating, not getting up to go to the washroom, not bathing, not, taking care of personal hygiene. And that hyper focusing is often a symptom of ADHD. So if you
Interesting.
find that you do that, you go like, and I'm not talking about, binge eating, binge watching Netflix, everybody does that. But what I meant is, 16 hours go by and you've only been, you've been coding or doing one video game, that could be suggestive that you have ADHD, right?
Yeah, I have heard that. I have heard that hyperfocusing is a pretty big aspect of it. Do you think there's something specific to video games? Do you think that there's something that would make video games, because I think a lot of people associate, anybody could sit there and play video games for 16 hours straight and not really think about it. Do you think that there is some aspect of video games kind of, because I think there's a big difference between binge watching Netflix and for 10 hours and
Totally,
playing video games for 10 hours, right?
totally.
Do you think that
Yeah,
there's a
I agree.
connection with hyper focusing? And
I,
like you said, it could be for anything, but video games
yeah,
specifically, I find they're
yeah, yeah.
unique because
I totally agree, and I think there's a huge difference between binge watching some video series on a movie channel versus video games, because the binge watching of television or movies is relatively passive, right?
yeah,
You might be munching on something, you might be having a conversation
it's
with
like
a
your
friend, but really,
relaxation time, it's your
that's exactly
downtime.
it. Whereas
Yeah.
with the video game, you're engaged, right? And you have to be on your alert. But that sort of takes me back to what, when you asked about what ADHD is, one element I didn't talk about before that's important is to understand the brain's biochemistry. So what we understand, and you may remember this from high school biology, is that when neurons communicate, they don't touch like this, right? There's a gap, and
Right.
that's called a synapse. And neurotransmitters have to go across that gap. And there's hundreds of neurotransmitters, like for example, serotonin and depression and anxiety.
Right.
But for ADHD, we recognize that there's two neurotransmitters that are deficient, so they're not going back and forth enough. One's dopamine, and the
Okay.
other one's norepinephrine. So going back to your question about the video games, what one theory is that when people do things like video games and they're getting excited and they're getting a rush from it, and whether it's a violent one or a car one doesn't really matter, but if they're getting sort of excitement from it, and they're drawn into it, they're hitting those dopamine centers, which sometimes
Right.
people call pleasure centers, right?
Yes.
And even some of the other things I said, the gambling, the sexual activity, the road rage, the weekend warrior sports stuff. People will actually self-medicate or self-treat. It's not a medication, self-treat
Right.
their ADHD by doing these risky behaviors, because why? It bumps up your dopamine. And if people
Ah.
have low dopamine levels, that's what will improve their ability to think and concentrate and so forth. So I think the mechanism that links video games for long periods of time and hyper focusing on video games is probably that it's hitting the dopamine that people with ADHD are deficient in. It actually also connects with substance use, right? So people that
Right.
are, using stimulants, so cocaine, crystal meth, MDMA, any sort of stimulant, what they're actually doing is they're hitting that dopamine center again,
Right.
right? A lot of people that use stimulants recreationally, they're actually hitting that dopamine center because there's a dopamine deficiency. Yeah.
That's really interesting, actually. That and makes it kind of adds to, like, binging, right? The binge eating, it's a little bit of dopamine, right? It's like you want to go to McDonald's and get a Big Mac because that's dopamine for you, right? And then you're like, oh, now I want two of them, now I want three of them, right? Like you're just constantly trying to keep up with the dopamine levels. And I guess if you have ADHD and the dopamine's lacking, you're going to do basically whatever you can to bump it up, because
Yeah.
everyone needs dopamine, right? That's happy
Yeah.
stuff. So
Yeah, and let me flip that into a positive. So a very healthy dopamine, a healthy way to raise dopamine levels, is exercise, right?
yes,
And
yeah,
so you may have noticed this, is that you may have a problem or something somebody said that just didn't make sense to you, or a problem you just couldn't solve. You get on that treadmill, the elliptical, or you go for a run, or you do some weights, and just right afterwards, that hour or 45 minutes, whatever it is that it affects you, you'll go, I got it. That was it.
right.
That's it. I understand it now. Or you get that brilliant idea, for your next podcast, Shannon. But you get that sort of, and what's happening there is the same thing. Your dopamine levels have gone up. So the joke I often make is I say to people, yeah, forget the medications and coaching and counseling, just exercise 24/7. I'm joking. Obviously, nobody can do that.
Yeah,
But if you could do that, so it's not just natural endorphins that go up. Everybody knows about endorphins. Exercise makes you feel good and happy, but
right.
it's also the dopamine levels that are going up that will help with concentration, focus. And students will say to me, I work out in the morning because that first class, man, I do
Yeah.
so much better in that first class. I'm attentive if I work out before the class.
Yeah,
Yeah.
it wakes you up, you get some dopamine. It's yeah,
Yeah.
I mean, working out obviously, has many benefits, but it's good to know too that even if you're I think that's great. Yeah, I think exercise is a great tool. So that's very interesting. Yeah, that's so I didn't realize, because I know it's endorphins, but I don't think a lot of people think of dopamine as a separate thing either, right? You go to the gym, you work out, you feel good, right? That's people associate with that, like endorphins, or for men, it's like my testosterone's boosting. I feel like, I feel good. but dopamine is super important and it is separate. So
Yeah, yeah. So Shannon, you touched on something, and I think we'd be remiss if we didn't speak about this.
absolutely.
Is that we do know that, and you reminded me of it when you mentioned testosterone. Is that we know that females' journey through ADHD is quite different than what males go through, and
Yes.
we could spend 3 hours talking just about that. But if I can just explain that a little bit
Yeah,
for your
absolutely.
female listeners,
Please do.
is that when you think about the stereotypical kid with ADHD, the child with ADHD, let's call him Johnny. You think about Johnny, and what's Johnny doing? He's disruptive, he's making farting noises, he's giggling in the class, and he's hyperactive physically, right? And Mrs. Smith, or Miss Smith, sorry, his teacher says to his parents, get Johnny fixed because he's driving her crazy, right? And he's disrupting the rest of the class.
Right.
Now, Jane, if I can just use that name,
Yeah.
may have ADHD that's just as severe, but her ADHD is a little bit different. Her ADHD is more daydreaming, is more inattentive, and not necessarily physically hyperactive. So her ADHD could be just as bad, but she's not disrupting the class and bothering the teacher. So her report cards will say Jane is a pleasure to have in the class, but she would do better academically if she focused a bit more on her work.
Right.
Now, why I'm sharing that is that, and you have to be careful. You always have to be careful when you tell stories like that because you're ingraining more gender stereotypes. And so
Right.
little girls can be just as physically hyperactive, and little boys can be just as inattentive and daydreaming. So there, so just be, I apologize if I'm ingraining stereotypes there, but I just want to talk about sort of generalities.
Right.
And so what that means, though, is that females tend not to get diagnosed as much in elementary school and high school, even though their ADHD may be just as severe. And so, for a lot of your female listeners, is that it's really important to think of why, and we see that boys are way more likely to get diagnosed than and little girls are. And what that means is that when a center like ours, where we're dealing with only adults, we find the ratios are 1 to 1. There's equal male and females have being diagnosed with ADHD. It's just that the boys got diagnosed earlier,
Yeah.
and our numbers are actually the other way, is that we see more females than males because now we're playing catch up. All the females that weren't diagnosed before, we're seeing them now, and now they've been struggled through school. They may be in relationships they're not happy with. They may have substance use issues. They may have had now developed coexisting conditions like depression and anxiety,
Right.
right? And so just to let and we know that estrogen plays a role. And I was reminded of this when you mentioned testosterone, is that we know fluctuations in estrogen can affect focus and concentration for a lot of females. So it's important, and I'm not saying it's for everyone, but just important to look at that and with your practitioner and understand it better. Now, the other bit when we talk about gender is also talking about our transgendered community members, is that we see a lot of people that are non-binary in our practice. And it's interesting. You probably guessed by now, Shannon, I'm not one to mince words or shy away from the awkward question.
No,
So I
of
asked
course.
one of the patients I was seeing, and I said, I need to understand this as not being a member in the transgender community, but um, do you find that there's a lot of people who are transgender that also have ADHD? And the person I was talking to said, and they actually ran a support group, and they said actually it's huge, it's absolutely huge that in the transgender community there's a lot of physical, psychological, sexual abuse history and trauma history, and that's important, and that's and needs to be looked at. But we find a lot of people are neurodivergent and have ADHD as well. So I don't know. It certainly isn't a cause and effect. It doesn't mean
Right.
being gendered is more likely to have cause ADHD or ADHD is more likely to make you transgender. We know that that's not true, but the association is there. And that also means that, so we've got a few projects where we're helping people in the transgender community to get diagnosed because we know that that can add to other issues that they're also dealing with right now.
I'm really, really glad that you talked about the difference between males and females, and actually the transgender community, because I hadn't even considered that as a separate issue in my mind. I just know that it has very much been spoken about, especially in recent years, that there is a great um, what's sort of looking for here, like the ratio of men and women that have been diagnosed is, it's very skewed towards the men. I've heard that again, generalizing,
Yeah.
that in females it represents itself differently than males typically, right? And that's also why it gets ignored, right? Like you said, Jane isn't disrupting the class and doing this, and you think of little boys and they're disruptive, or they're doing this, they're acting out there, and generally that's how it's been looked at for so long. And I know that there is a huge lack of representation, or at least there was. I'm sure we're getting closer, and obviously people like yourself and your centers and your communities, which are doing amazing work, like you're trying to, balance the scales, right? Like obviously men and women are equally susceptible to any disorder, any disease, or anything generally. I know that, like you said, there are some factors, and that is an interesting point that you bring up, is that there is a difference biologically between men and women, and why it may represent differently in women generally, right? Because I would have never known that estrogen plays a role in how the ADHD presents itself. So that's very interesting, and I'm really glad you talked about it. And the transgender community thing is also very interesting, because I think right now, because it's more open, there's more research being done on sexual identity and things like that, and I think it's also important to see if there is correlation in anything, right? Because you said it's interesting that you hear that there is a majority, or maybe not a majority, but there are a lot of transgender folks that are ADHD, suspect they're ADHD, like what's going on there, right? It's very interesting, and I think especially now it's very important to consider, transgender groups as well, or whatever, sexual identifying groups that are out there. I mean, all of the data is important, and I'm sure that especially now, I'm sure your teams are focusing a lot on balancing the scales, representing other communities like the transgender community. Do you find that you get a lot of transgender people that
Yeah,
come to you?
yeah. And I would say I would suggest this. We're looking at the data right now, but it's probably disproportionate. So we're probably seeing a disproportionately higher number of people with that are transgendered and wherever they are on their transition journey. But we're seeing more than you'd expect for the population. And so either people are talking about it more, and again, it's a good thing. It's good that this is being looked at, and we don't necessarily understand why yet. But the why it'll be good to understand the why as well. But certainly making sure it doesn't get missed.
I wonder too if there's again correlation between the female side and the transgender side of like lacking diagnosis. Do you think that there's maybe a chance that the transgender numbers may look exaggerated because, generally speaking, maybe they haven't been seeking out medical advice before, and now everybody's starting to come forward? Do you think that may be a factor in that?
And we're finding that even generally is that 7 years ago nobody was talking about adults having ADHD,
Right.
and now there's increased awareness in the public. And you've seen them on TikTok and Instagram and all the social media sites. People are talking about it. Comedians make jokes about it. It's in sitcoms, and
Yeah.
so there's certainly, and I have a lot of problem about comedians making jokes of it and being in sitcoms. But the point is, there is an increased awareness in the community, and what that means, the general community, and what that means is then people will go to their practitioners, whether it's a psychologist, counselor, therapist, physician, whoever, and say, well, I wonder if I have this. And then those practitioners are having to address it and maybe diagnose it, hopefully, and then help manage it. So it's understandable that the numbers are going to go up, just in terms of general awareness. And depending on what the person in the transgender community is dealing with, they may be seeing a psychologist or counselor for other issues.
Right.
And as part of that discussion, perhaps it comes up, right? Because because they're dealing with other health issues, and maybe they're more likely to be attending for medical care, and psychological care. And as part of that discussion, it comes up. So it's hard to know. I think a
Right.
lot of it is just an increased awareness right now.
Yeah, I think increased awareness is playing a big factor in that, and also circling back to something you mentioned earlier, is that your environment can exacerbate the symptoms of ADHD, and I think again this is very generalized, but I think in the transgender community, I think it's discussed and it's well known that in a lot of cases they have difficult environments that they manage, whether it's they're having identity crisis within themselves, maybe they're not in a comfortable family situation where they can't talk about these things. So do you think that maybe that could also be a factor in the
I
high
think,
numbers? Is that
I think,
the
yeah, and I think the data is very clear that people who are transgendered are more likely to have experienced, physical abuse, sexual abuse,
Yeah, of course.
psychological abuse, so past trauma for sure, and they may be seeking some help to help with those aspects as well. So there's a lot to a lot of work that needs to be done, and also the medical system. and I'm going to be blunt here, but the medical system has also contributed to that bad behavior and not treating people that are transgendered with the respect that you would other people. And so there, a lot of transgender people's experience with the medical system has been quite traumatic, right?
Yeah, I yeah.
And that's been and that contributes to maybe delayed diagnosis or delayed treatment. If you go in to see a doctor at a walk-in clinic and he offends you or he says something that's discriminatory, how likely are you going to go back and talk about a sensitive, intimate problem,
Yeah, if you don't
right?
trust the system, you're not going to use it.
Yeah, yeah,
Yeah. And I think, and I'll say this for the whole podcast, but for saying that specifically, like, we appreciate people like you, like, being blunt and acknowledging that nothing is perfect, of course, but everything can always use some work. And I think it's important that, people like yourselves that kind of have some power and authority, I guess, for lack of a better word, that like acknowledge, okay, look, like things haven't been good. We have to recognize, like you said, specifically with the trans community, that, like things need to get better so that, everybody at the end of the day is a human being and they deserve all the help that they can get. Right.
absolutely.
And I
Nicely
think that's
said.
important that everybody here should be on a level playing field, whether you're trans or POC, man, woman, doesn't matter. Age doesn't matter. Like, I don't think that the healthcare system should be discriminatory. I think it should be, scientifically based. I think it needs to be managed by people like you that acknowledge where
Yeah,
there's shortcomings, where there may be trauma, things like that. So I appreciate like the candid sort of attitude, because I think it also makes it like more, like we like hearing these things, right? This is
yeah,
also how you develop trust in anybody, is you
yeah,
say, you know what, no, like things haven't always been good. We acknowledge that the trans community always hasn't been treated the best in the medical system, and there's gaps, and like you're just working to make it better. That's very clear, right? And I
yeah.
think that's
Yeah, and that's important to acknowledge. And even if we take it back to ADHD, takes up a lot of courage for a young person. Say, they're at Cornwall and they're going to go home for the winter holidays, and they go to their doctor and say, I think I'm struggling. I think I have ADHD, and the doctor laughs them off, right?
yeah,
Or says, no, you don't have it, or no, you don't. Everybody thinks they have it today, it's just too much screen time, or it's bad parenting, or you would
yeah,
do better if you just found your purpose in life, right? And brushes them off. And so, we're also dealing with massive amounts of social stigma
right,
around ADHD, and people thinking it's just a cop out. I did an interview for one of your Ontario newspapers a little while back, actually not a little while back, a week and a half ago, and it was interesting. I try not to read the troll comments, but I was tempted this time.
yeah. You got to stay out of
And
the YouTube comment
I know
section.
I
Yeah,
gotta stay out of them.
yeah,
But I read one that and I haven't dealt with my own I guess anger around it. Is Somebody posted, well, isn't this going to be great for criminal defense lawyers? Because now anybody who commits a crime is going to say it was because they impulsively acted because of their ADHD, and it's going to be a
mm,
defense for committing a crime. And then a bunch of other people kind of knocked that comment down and criticized it.
right.
But even the fact that the first person had said it, I thought to myself, all this increased awareness about ADHD, and we're dealing with the stigma and so forth. Now you're getting people almost going the other way, which is saying it's a crutch, and
Right.
does everyone have it? Like Shannon and I was at a national meeting, and I'm almost embarrassed to share this, but it was a great presentation about something to do with ADHD, and the person themselves didn't have ADHD. But at the bottom of one of their slides, it was just there was something they were trying to explain, and it was a bit complicated. At the bottom of their slide, they wrote down, "I think I might have a bit of ADHD," with a smile emoji, right?
Right.
And I was so upset by seeing that. I said, I think I might have a little bit of ADHD myself, and a smiley face emoji. And I was so upset by that I couldn't pay attention to the rest of the presentation.
Yeah.
And and why and I was thinking afterwards, and like I said, I have to unpack it myself. But why I was upset by it is, this isn't something that's flippant, right?
Yeah.
Like it's kind of like people saying, "Oh, I think I've got a bit of dementia." No, people who are suffering with dementia, you don't make light of mental health conditions, right? As somebody who has dementia, you don't have a little bit of dementia. And so it's likewise with ADHD. it's a condition that you have if you meet a certain amount of diagnostic criteria. And then, whether you need treatment or not, or pursue it or not, that's up to you. But it's a medical condition. You don't
Yeah,
have a
of
little bit.
course.
And, and and the silly joke I made is I said it's kind of like being a little bit pregnant. There's no such thing. You either
Yeah.
are,
Yeah.
it's you either are or you aren't, right? And so I have a lot of problem with sitcoms and stand-up comedians making jokes about ADHD because ask the person who's struggling with it, right? This is put their life on a trajectory that they didn't want to be on, and spiral their relationships and their schooling and substance use and a whole bunch of other things in life. Car accidents. We know people with ADHD are more likely to drive without a license, get into car accidents, get more traffic tickets, more speeding tickets, and get into more accidents. Right? I remember this young woman when we first started the center, Shannon. She came in and said, "I need help," and I said, "What happened?" She goes, "I got into an accident." And I said, "Can you tell me about it?" And she goes, "Do you want to hear?" And I said, "Kinda." And she made a left turn, hit a motorcyclist, and the motorcyclist, I guess good and bad, lived, but because of the accident, he lost his leg. And she's dealing with the guilt of this now, basically for the rest of her life, right?
Yeah.
And she said it wasn't her cell phone. She was fiddling with something on the sound, like she was adjusting the speakers or the music in her car, but she wasn't paying attention,
Right.
right? And so, talk to people who've been in accidents, and this isn't just something that's, a light condition. It can have pretty significant consequences.
Yeah, and I think you touched on something important, and circling back to how you said, it's talked about a lot on social media, and there's comedians that talk about it and sitcoms and this and that. I think, and I like the term double-edged sword. It kind of applies to a lot in this. Recognition of anything is always a double-edged sword, right? Because now all this stuff has been brought to light, like the transgender community, and like you're talking about specifically about ADHD and how it's being talked about a lot more and it's brought forward. um, it's tough, right? Because you want it out there. You want people to be okay with conditions, or like know that it's it. You want to get rid of the stigma, right? By opening up the conversation, and it gets opened up to that, like you said, the internet trolls and comedians and things like that. So it's very tough, right? And also I wanted to ask you about your.
Okay, John, can I
Oh yeah,
can
yeah.
I
Go ahead.
interject
Go ahead.
something there? There's something there that we haven't touched on, and that's the prevalence of ADHD. So when we say, for example, and I said it, where everybody's talking about it, and doesn't everybody have ADHD right now? So I think it's important for your listeners to know how common it is in the Canadian population, right? So the data right now tells that for people over the age of 18, it's about 4.8, 4.9%. So let me just round that to 5%, just
Okay,
for
sure.
easy.
Yeah.
So 5% means 1 in 20. And Shannon, why that's important is if you're in a class, let's say it's a tutorial group and there's 30 students, right? If there's 30 students there, one's going to have it, right?
Yeah.
Because it's 1 in 20. So 20, let's say if there's 20 students, one's going to have it. You're at a party with 40 people, there's going to be 2 people in the room with it.
Yeah.
This is not a rare condition. So when we talk, we almost always will know a friend, a family member, a work colleague, a school classmate that has ADHD. 1 in 20 is not rare, right? It's not like 1 in 1,000.
Yeah.
So when people are talking about it, that's okay because 1 in 20 people have it, right? This isn't like some rare genetic condition that is going to be 1 in 1,000 people. 1 in 20 is pretty common. And so when people are talking about it, that doesn't mean that it really, and I'll tell you at our own center, we don't diagnose of the people coming to get assessed. About 15 to 20% don't have ADHD. So we have to tell them you don't have ADHD. Now you have focus and attention and concentration problems. Let's figure out what that is.
Right.
But it's not ADHD. So sometimes it ends up being, for example, a sleep disorder, right? They're not like a sleep apnea. So
Right.
they're not sleeping at night, which means they're drowsy in the daytime, so they can't concentrate. It could be severe anxiety. It could be severe depression because anxiety and depression can cause problems with focus and concentration,
Right.
right? It could be anemia. It could be a hearing problem. It could be a learning disability, which is probably really important to your university students.
Yeah, of course.
So I guess what I'm saying is, just because somebody comes to us, comes to the ADHD center, doesn't mean we're going to diagnose ADHD. In fact, the toughest visits that we have are the ones where people come thinking they have ADHD and they've got the wristband, the T-shirt, and the tattoo. Sorry, tat. I'm supposed to be with the times here. And they've got the tat that says, I've got ADHD, and we have to convince them they actually don't, right?
Right. Right.
So those are tough
I was
conversations,
gonna say
right?
that must be very difficult.
Oh, definitely. And then what we do is, and I tell all our practitioners at our center, we're not going to abandon the patient. Just because they don't have ADHD doesn't mean we don't help them. We still have to help them. It just isn't ADHD. We're going to help them with whatever condition they do have, right? But 1 in 20, I mean, it's a
That's
common condition.
significant. Yeah, that's a lot.
It's very significant. And this is the other number that's important. Of the adults who have ADHD in Canada, 80%, 80% have never been diagnosed or have never been treated. So they might have been diagnosed and then their parents or whoever decided they didn't need treatment. But 80% of the adults who have ADHD in Canada right now have never been diagnosed and will never been treated. Like that's a
That's a
big number.
huge number. Yeah.
Yeah, yeah,
Yeah.
yeah.
That's crazy. I wanted to also bring up the presentation you talked about and how that person was like, I might have ADHD, haha. I think that kind of stuff kind of makes me upset as well because my oldest daughter is diagnosed ADHD, which is also why
Mm,
this is very close to me. And one of the things for me about that is that like my daughter's condition, like it required intervention and it has made huge
good,
improvements in school. The school was where we noticed
good.
it, and it's gotten 1,000 times better since we've been seeking the treatment. And
Excellent.
but the
Excellent.
problem for me is that especially because it's my kids and obviously you're attached to your kids, and the thing that's hard for me is seeing that kind of stuff is it like invalidates like a very real thing, right? It's like you're not taking it seriously. It's like somebody who likes to clean house, they're like, oh, I'm just like OCD. It's like, no, you just don't want to live in squalor. That doesn't mean, you know what I mean? Like you can't, it really invalidates it, right? And
Totally,
and a
totally.
lot of
Yeah.
people are very comfortable being kind of too casual about a lot of things like that. And I think digital media age, and especially since COVID and lockdown, I think people have kind of like detached themselves from like how much words like affect other people, right? It's you talk about troll comments on YouTube videos. I mean, those are people who are hiding behind a computer all day. They get no repercussions to what they say or what they do, and they get away with that for too long, and that's how they kind of end up like that. And I think COVID also did that too. Is people got too casual being locked in their house the whole time. Those are a lot of people that don't really talk. That shouldn't be talking like that out in public. You can't be essentially making light of or making fun of any condition of any sort, right? I
Yeah.
mean, it
And the
matters.
irony there, Shannon, is that, and of course I can't diagnose it, someone who posts something on a website, but it makes me wonder, was that an impulsive behavior? And could they have ADHD, right? It makes you wonder.
Yeah.
There might be a medical condition. I mean, it could be just bad behavior, but it could be that they themselves have trouble with impulse control, right?
Right. And yeah, sort of my last point on the social media thing when you're obviously you laughed that you're with the times. But you mentioned TikTok and Instagram and all these things that are really popular. Do you spend any of your time, I guess, scrolling on TikTok, sort of just kind of like seeing what people are posting? Like, do you kind of study
Yeah,
social media in
we
general?
did.
Because that's probably an
Yeah, I
interesting
did. Yeah,
land.
I was asked this question because you have colleagues and counterparts. It wasn't at your university, but another one, and they have a lot of followers. And she's talking about her journey with ADHD and being a
Right.
post-secondary students. And so the reporter for I think it was Globe and Mail or something asked my opinion of that. And I emphasized what you and I've already talked about. I said the increased awareness is brilliant. It's actually really good. I want people to think who hadn't otherwise thought they might have ADHD start thinking they might have ADHD. Where I draw the line, though, is if somebody thinks whether it's an online questionnaire or it's like you've got these three things, you can't diagnose ADHD that way,
Oh
right? You
yeah.
you need an interview with a human being who's going to take your entire medical history, the medications you're on, what you were like in elementary school, what you're like now, what your family history is like, your physical conditions, your psychological conditions. You have to synthesize all that. So I have no problem with social media raising the awareness, but just don't rely on that to confirm that you or rule out that you have any medical condition, not just ADHD. You really need to see your health professional for that, whether
Right.
it's a
and
psychologist
you,
or
and
whoever.
and you want
Yeah,
somebody that like has
yeah,
experience and other data, like, so for yourself,
yeah.
like how many years have you been working in this field?
Exactly. So I've been a physician that's been treating disabilities for 30 years, but in terms of just the ADHD center, it's been 7 years.
Right.
And we're over 20,000 assessments from coast to coast to coast.
That's a
And
lot.
so we've seen really, really complex patients and so forth. And often we look forward to seeing the complex ones that other people can't. So I guess what I'm saying is, it's nuanced. And
Yeah,
there are
very
some
much so.
things that get missed, and there are people that get diagnosed that don't have it, and people who, we say don't have, or somebody says they don't have it, and they do have it. We didn't unpack the symptoms well enough. Yeah,
Right. And well, and I think, you touched on it early in the interview. Everybody is different.
yeah,
People are so complex that, and that's why none of this stuff is just black and white. You can't look at somebody and be like, "Hey, you definitely have it, and you definitely don't have it." There's nuance. Everyone's so different. I think the important thing with social media as well is, like you said, it's good to bring up awareness, but I mean, taking a BuzzFeed quiz, that asks you 5 questions, I mean, is not, Dr. Pahar that's been studying, working in the physician field for 30 years and ADHD for 7 years. I mean, out of the two, who is probably going to have a better answer for you? And I think it's really important, especially the younger generation coming up now, let's say Gen Z or a little bit younger. I think it's Gen Alpha. Is that what we're calling them? Don't quote me on that. But, the Gen Alpha, like, my kids, right? Like, growing up on TikTok and this and that, it's like, look, TikTok is fun. You can scroll on it. It's a little mind numbing. It's cool. But, if you're watching things like that and you're seriously considering certain things, don't go on a BuzzFeed or on a Facebook quiz. Like, talk to, well, I mean, your parents, of course, but, your school, or go see a specialist. I mean, that's what we still have to emphasize, right? Is
yeah. And that leads to another point: is what would we recommend as next steps for your listeners who think they may be struggling with ADHD? So first is, if you're lucky enough to have a primary care practitioner, and I totally appreciate that not everyone does in this country, but if
right.
you have a family physician or a nurse practitioner, or through student health, go and talk to them and say, these are the symptoms I'm having. And so if they may be able to direct you or help you with the diagnosis. You can see a psychologist. Counselors and therapists usually don't make the diagnosis, but psychologists can. So if you have access to a psychologist, that would help. And if none of that's working and you're limited, and I know we are, this is why centers like ours exist in the country, is that we have practitioners in every province and every territory that are licensed. And you could just go to our website, adultadhdcenter.com, and either we'll help you with the assessment ourselves or direct you to someone else if you have a question. But the website's got tons of information. I guess my main message, Shannon, is that if you're struggling, and you're not sure if it could be ADHD, do yourself a favor and at least get assessed, right?
Yeah.
Because then, even if it's not that, at least you ruled it out. But you should get assessed just so that you aren't struggling anymore. And we tell people, life can be better, right?
Yeah,
And
absolutely.
university life is 4, 5, 6 years, and it doesn't have to be as painful as it will be if your ADHD isn't addressed.
Right. So actually, that's great because we're kind of getting to the end, and I know that you don't have a lot more time. So I just want to kind of a couple more things.
Sure.
And the one thing that you did start talking about, and one of the questions that I had was, where can students, or anybody, but for our purposes, where can students learn more about ADHD? Whether it's trying to figure it out for themselves, or they want to learn, maybe they got a friend that has it and they want to know, maybe instead of grilling your friend all the time because they're tired of talking about it, like, what are some good resources to learn more about
Sure.
ADHD in general?
So yeah, sure. So we've got our blog writer has self-disclosed that she has ADHD. So we've got a ton of information on our own website. So I'll just give you that URL again.
Yeah,
So
go
it's
ahead.
www or adult ADHD. So adultadhdcenter.com. And center is the Canadian spelling with RE at the end.
Okay.
So adultadhdcenter.com. And from there you'll see medications, lifestyle stuff, a lot of educational events. You'll see a lot of information on there. Two organizations that are really helpful and not influenced by industry and other sort of financial things, are CADRA, CADDRA, and this is the Canadian Alliance on ADHD in the country. And really, they're the ones that produce the guidelines on how we diagnose and treat ADHD. So CADRA, CADDRA, and then the other organization is CADAC, CADDAC, and that this CADAC is more for families and patients and themselves. Is more of an advocacy thing, but they actually are more for the community of people who have ADHD. So both those organizations, and I'm guessing, Shannon, if you haven't gone there for your daughter, you may have looked at it. So CADAC has a lot of really good resources for family members and so forth. So CADAC and CADRA would be the two big national organizations. In fact, CADAC's meeting is this weekend in Calgary, and I'm flying out tomorrow. I'm asked to give a presentation on ADHD and relationships. And so we're doing that tomorrow. And CADRA just had their meeting in Montreal, but I'm looking forward to that meeting in Calgary this weekend.
Amazing. Yeah, you seem you seem very much like you're obviously very passionate about this. You've studied something very niche and important to you, and it clearly reflects like in how you speak about it, and I would imagine that people must enjoy your presentations because it seems like you're just this is you, this is your thing, and you like to bring awareness to it, you like to talk about it. You're very clear and concise, you can explain things in a way like you laugh about your 3-hour lectures right in university, but I mean nobody talks 3 hours about something that they don't like or that they don't understand, right? I think that's really important to acknowledge. Sure, your students might get a little bored after 45 minutes, but like you don't, right? Clearly this is like really important to you, and I think it's some fantastic work, and I hope you do really well at the presentation. Not that I'm concerned for you by any stretch, but I'm sure they're gonna appreciate that. I and on that note, I just want to ask: is there a particular success story that you would like to share with us? I know, obviously, barring personal information, but is there something that happened to you, let's say in the last 7 years at your ADHD center, that like really resonates with you and what you've been striving to achieve?
Yeah, I will, and I'd be remiss, Shannon, if I didn't share another message
Yeah, please do.
that I like to get in front of post-secondary students. And you didn't ask it, but I often get asked this: is what happens if you don't have ADHD and you take your roommate's ADHD medicine, right?
Oh, that's a good question.
And so people, and you hear multiple stories of this, and typically they'll say Adderall or whatever, and they'll say, but doesn't everybody benefit from taking ADHD medications? And I have to tell you a quick joke, and just to tell you how, I'm just as guilty about wanting an edge when it comes to academics. When I was in my pre-medical days, I was at Simon Fraser University here in BC, and we used to sneak down. I remember I didn't have a car, so it would be 3 buses, and we go to the drugstore, and we sneak in like we were some sort of cartel. And it was not even behind the counter prescription; it was right on the regular counter was this bottle, and some of your older listeners might know this. Is a little red rooster was on it, and then we'd buy it, and we'd sneak back to our dorm room, and we take this tablet. And in fact, what it was it was called Wake Ups. It was 10 milligrams of
Yes,
caffeine,
I am
right?
familiar with those.
Yeah, yeah. And it was, and studying science, whatever you were studying, but it was interesting because we thought that would give us the edge, right? Like that would, oh yeah, our brain's gonna work better, we're gonna stay up all night and do this.
Right.
And the wake ups will help me do that. Not knowing how idiotic we were, that 2 cups of coffee were probably more milligrams of caffeine than the silly tablet, right?
Yeah.
But that's how silly we were. But so I guess I paint that because I paint that scenario to say that I was there. I understand that students want an edge and want to succeed, and sometimes have left things the last minute and they really have to get stuff done. So I'm there. I hear you, right? But if you don't have ADHD and you take ADHD medications, which are typically stimulants,
Right.
what you're really doing is you're increasing your alertness, right? And it would be like taking that coffee or taking that energy drink. So when somebody says, I took ADHD medicine, I don't really have it, but I stayed up all night and got the term paper done, or I
Right.
studied a lot and I did better on the exam, that's because your alertness went up, right? It's not because your brain was deficit of dopamine and norepinephrine and now it's firing better. Ask somebody who has ADHD, when they take their ADHD medicine, their brain works differently. They'll be alert too, but their brain works differently. That's dramatically different. So there was a study done, and this may fascinate you. There was a study done where they took everybody in the study did not have ADHD.
Okay.
Okay, so none of these students have ADHD, and the university students, and they took half of the students and they gave them ADHD medication,
Okay.
and the other half they gave them a placebo, so nothing, right? And then they had both groups. Remember, none of them have ADHD, so
Right.
and then they had both groups play computer chess to see, did the ADHD medicine improve their functioning with the chest, or better than the placebo, which is that they were taking nothing. So what they found was, no, they didn't do any better. So if you didn't have ADHD and you were on the ADHD medicine, you didn't do any better than the person who had ADHD and took a placebo, right?
Right.
So you didn't do any better. But here's the thing: you might know this with chess. You know how they've got a timer, so when you move, you got to hit the timer.
Yes.
So, but the people with ADHD took longer to make a decision. Sorry, people taking the ADHD medication took longer to make a decision. So
Right.
they didn't do any better, but they overthought everything, right?
Right. Okay.
So one of the reasons I like to share that to post-secondary students is, don't take your roommate's ADHD medicine.
Yeah, I think that
It's actually working just as a placebo. It might be helping you stay awake, but you're not doing yourself a service there. And there are lots of potential side effects.
That's
So
actually
don't
that's a really good thing to bring up. I can't believe I didn't even think of that question because you hear about that all the time, right?
all
As
the
college,
time.
university
Yeah.
students, yeah,
Yeah.
I had stuff to do, so I took some Adderall and I got
Yeah.
it done.
So,
And
so
but
I
so
so, yeah,
it's
whenever I get in front of university students, I always want to share that because, and if you see somebody who is, tell them to stop. Don't do it. You're not doing anything.
right.
If you really want to stay awake, take that energy drink or
Yeah,
take the
I was
coffee,
gonna
right?
say it sounds like at this point it's no different than just taking back a an energy drink or caffeine pills, I suppose, right? Because or just drink a bunch of extra coffee. Everyone's
Yeah.
got a Keurig in their house.
Yeah.
So I'm pretty sure they
But
come with dorms now. So
yeah.
I think
Yeah.
that is really
So,
important to bring up. Yeah, that's a
well,
good
thank
point.
you.
Thank you for mentioning
And
that.
no worries. I was gonna. So you wanted a story, and this is probably the most telling. Is it was a young woman. She was in second year university, and she had to come back to us to adjust her meds. But so we diagnosed her, and then she got onto her treatment, and she came back, and I said, "So how you doing?" And she goes, "Dr. Parhar, I don't know how to explain this, but I'm not that same person anymore." And I said, "What do you mean?" She said, "I have a lot more confidence. My family, my friends say I'm a changed person. I actually, speak up in meetings. I speak up at family dinners. I have a lot more confidence. And I've got a path going forward." And I realized I was in all these ridiculous relationships where, I was in them out of default because I thought I couldn't be with somebody that I really wanted to be with. So I defaulted to people who I didn't really want to be with. And she'd also had some substance use and binge drinking. And she said, I can control that now. I drink when I want to drink, but it's not, I don't go out of control. And I said, okay. And she said, and not even to mention about school. And I said, so how's school better? And she said, well, Dr. Ware, when I go to lectures, I actually learn stuff. And I'm like, I said, sorry, what were you doing before? And she said, well, no. I said, well, no, seriously, what were you doing before your ADHD was treated? She said, well, I would go to the lectures and I would meticulously write down everything the prof said and the slides. I would just take copious notes. And that's it. I wasn't actually hearing or understanding anything. I just took copious notes. And then I would go back to my dorm room and actually try to understand them. And I couldn't, or I struggled with it. But that was my existence. And I said, well, what happens now? And she said, now I'm sitting in a lecture theater, not 100%, but I'm understanding about 80% of what they're saying. Right. And I take the notes and I still go back to my dorm room, but I'm only working on that other 20 I didn't get. But
Right.
the other 80% I understood. And that's what made me think, Shannon, that, you know what, this work is important. Right. And so she didn't know that the rest of the world was actually learning in the lecture theater. She thought she was there as a scribe to write down a bunch of stuff and then learn it later. And how would she know? She's only got the one brain and the one life,
Right.
right? You don't know that the other 90% is functioning quite differently than you because you're dealing with your brain and the way you've always been. And so now when it changed, and she also said something else to me that I'll never forget. She said, Dr. Parr, you don't realize how quiet your world is. And I said, what do you mean quiet? And she says, I used to hear the buzzing of the lights, the mosquito in the room, the tip, tip, tip of somebody walking with heels down the hallway. And she said, I would hear all that and not what I was really supposed to be focused on. And she
Right.
said, once I started the ADHD treatment, everything went silent. And so she said to me, she goes, I asked her if it said, when I write my book on ADHD, I hope to someday, that'll be the title of one of the chapters. You don't know how quiet your world is, right? Because to her, the world had a lot of extra noise that she could not filter out.
Right. I mean, obviously, that's a huge improvement on her life, and I would imagine that you must feel like that every time that you end up
Well,
with a
it's
good case.
interesting, and maybe this will be the final note, is that, I've been a doctor for 30 years and I prescribe cholesterol medications and diabetic medications, what the general doctors prescribe.
Right.
I often tell people that ask me why I'm doing this, I'll say, I'm not sure how many lives I've saved or if I've saved any. I'm not sure. After years of giving cholesterol medications, have I really prevented a heart attack? I hope so, but I don't know.
Right.
I said, I can tell you with every ADHD patient we see, we've changed a life, right?
I mean, there's nothing better to say. That's incredible.
And so I do it because it's extremely satisfying to see people, improve their lives and move forward. And, you shared some stuff about your daughter. She's blessed to have had you as a parent who is in tune and helping her through this, because then she doesn't need to be somebody comes to us as an adult saying, where were you when I
Yeah.
needed you when I was younger? So this is what we're trying to address. There are all those people that have struggled for too many years.
That's amazing. I don't know what more you could say than that. Honestly, that's I think you wrapped up you beautifully, just you as yourself. Um, I think I think we're running out of time there. I know we're pretty busy, and you must be as well. You said 20,000 cases is not a small number. Before we wrap things up here, is there anything that you would like to say, add something we didn't touch, a shout out? Do you want to plug something? Like just the floor is yours.
So I want to thank you and your colleague Nandish, Shannon, you Shannon, and your colleague Nandish for taking the initiative. I think this is an extremely important topic for university students, and you increasing the awareness about this is it's a privilege for us to be here to help spread the word. And you're doing a great service by spreading the word about ADHD, and we're indebted to you for that. And my parting words would be that if you are having challenges in your personal life, in your family life, in your school life, don't hesitate. Get assessed, and if there's anything we can do to help you, the adultadhdcenter.com. And even if you can't afford some of the assessment services, we have a compassion program, and we'll make sure that it happens, even if we'll cover the cost for you. Yeah.
That's amazing. I hope one of these days, if you ever decide to come to Ontario and you come to our little town, make sure you come in and stop by, or we'll have you do a presentation at the college. I think that'd be amazing.
We just opened up our Mississauga office, so we do go back and forth. So I may just take you up on that offer soon. Yeah,
You have our contacts, so make sure you reach out to us one of these days.
great.
Thank you so
Take care.
much. Yeah, thank you so much for taking the time out of your day. And thank you for all the incredibly valuable information. And and really at the end of the day, we're indebted to you and people like you. We're just the guys that sit here and talk about it. You're the guys out there doing the real work and working in the field. So it is with utmost gratitude that you are out there doing that and working in the trenches. So thank you for taking the time. And yeah, hopefully one day I'd love to talk to you again, or see you around the campus. Come on by for a visit.
Great. Thank you, Shannon, and appreciate the opportunity.
Thank you so much. You take care.